Hello, I'm Dawn Upton, a St John ambulance trainer. The following advice will explain how to look after somebody if you find them and suspect them to be unconscious. If you find a patient when you think they're unconscious, the first thing you need to do is check for danger to yourself and to the patient. If you can make the area safe, then do so. Approach the patient and ask them a question, a direct question such as, "What's happened? Can you hear me?" Give them a command such as open their eyes. If you get no response from the patient, kneel down next to them and gently put your hands on their shoulders. Shake the casualty's shoulders, but don't shake them so much that their head moves. Please bear in mind they may have a neck injury and you don't want to make it worse. If you do get a response from the patient, then ask them what's happened, deal with them accordingly, depending what injury they've got. Please refer to the other tips. If there's no response, then shout for help. Once you've shouted for help, you need to check whether the casualty is able to breathe. To do this, we go through our A-B-C procedure, or airway, breathing and circulation. For somebody who's unconscious, they need to have an open airway to enable them to breathe. Kneel down next to the patient and put one hand on the casualty's forehead and gently tilt the head back. This will allow the mouth to fall open and you can have a look in the mouth to see if there are any obstructions in there. If you can see something and it's close to the front of the mouth, then just hook it out. But please don't blindly finger sweep around. Once you're satisfied there is nothing in the mouth, put 2 fingertips on the point of the casualty's chin. Maintain your hand on the casualty's forehead and using the 2 fingertips on the chin, gently lift the chin. This will tip the head back and it will actually move the tongue away from the back of the patient's throat, hopefully enabling them to breathe. So if you remember, it's a tilt, look, lift action to open the patient's airway. By having an open airway, the casualty should be able to breathe. To check the breathing, you need to put your ear and cheek close to the patient's mouth and nose, looking down the chest, and you're going to look, listen and feel for breath sounds. And you'll do this for up to 10 seconds. If the patient is breathing normally, place them into the recovery position. If they're not breathing normally, please refer to the CPR tips for the relevant age group for adult, child and infant. A child is age 1 to puberty and an infant is under 1 year. I hope you found this information useful, but please remember these tips are no substitute for formal first aid training.